Welcome to the Pearson Centre Conference on the new challenges for the Canada we want. My name is Andrew Cardozo, and I'm president of the Pearson Centre. I want to start by recognizing that the Pearson Centre is headquartered on the traditional territories of the Algonquin and Anishinaabe peoples, and we welcome our speakers and audience who are joining us truly from across Turtle Island today. As you may know, the Pearson Centre is a leading progressive think tank that addresses the challenging social, political, economic, and international issues of the day. We are proud to say that we are one of the few think tanks that invites representatives from all 5 political parties represented in the federal House, along with top business, labor, civil society leaders, and many other experts. As we like to say, we bring people and ideas together. A special thank you to all our donors and sponsors, especially our sustaining sponsors, who include Canada's Building Trades Unions, MAPCO, Ontario's professional employees, and the International Association of Firefighters, and our special sponsors for this conference, who include Bayless Medical Technologies, the Hill Times, and Canadian Health Coalition. Just briefly on the format, we have an hour-long conversation where the moderator will engage with the panel for about 40 minutes, and then we'll take questions from you, the audience. So please send in your questions on the question box at the bottom of your screen. Our webinar today is on Pharmacare. How do we get it done, and what do we need? We have an incredible panel of people who really know the ins and outs of what has to happen in the weeks and months ahead. Dr. Brendan Hanley is a Liberal Member of Parliament for the Yukon. He's a member of the House of Commons Committee on Health. He's been a Northern physician for over 25 years with a focus on rural, remote, and Indigenous populations. Passionate about public health and emergency preparedness in the North, he became Yukon's Chief Medical Officer of Health in 2008. Linda Silas has been the president of the 200,000 strong Canadian Federation of Nurses Unions, CFNU, since 2003. She's recognized as the foremost advocate on behalf of nurses in Canada. She champions greater understanding and action on social determinants of health and key policies that will enhance socioeconomic equity, such as retirement, security for all workers, a national Pharmacare program that we will talk about today, universal childcare, and greater access to public service for Indigenous communities. Don Davies is the Member of Parliament from Vancouver Kingsway. He is a human rights advocate and the NDP spokesperson for health, and is a member of the Commons Committee on Health. He's a lawyer by training, was the former director of legal services for Teamsters Canada, Local 31, a position he held until his election to the House of Commons in 2008. Now, with the new Liberal NDP agreement, Don Davies will play a critical role in making sure that Pharmacare becomes a reality in Canada. I'm pleased to say that our moderator today is Indira Naidu-Harris. She's one of the co-chairs of the conference and is a member of the Pearson Centre Advisory Committee. She is the Associate Vice President for Diversity and Human Rights at the University of Guelph. She's the former Ontario MPP and Minister, and was part of the provincial cabinet, the only provincial cabinet that brought in a Pharmacare program 5 years ago, which was for people up to the age of 25. Now, sadly, that program was canceled by the subsequent government, but it is an important decision that she was part of. Her cabinet portfolios included education, early childhood education, and women's issues. Before we start, I'd like to ask Stephen Staples to say a few words. He is the National Director of Policy and Advocacy for the Canadian Health Coalition, who's sponsor for today's event, and also has assisted us in pulling the event together. So over to you, Stephen.
Thank you, Andrew. Just very briefly, I want to thank all the panelists for participating today, and the Pearson Centre for your very exciting conference that's been going on in today's session on getting Pharmacare done. You know, we work with frontline healthcare workers, experts, and community groups, and one of the things that we hear from those people that are in hospitals is constantly that filled prescriptions means empty emergency rooms. So having accessible medicines for everyone is key to relieving the absolute pandemic-induced crisis that's in our healthcare system right now. And we really believe that Pharmacare is a shovel-ready program from Dr. Eric Hoskin's report in 2019. We know what the plan is, and we'll have so many benefits in terms of improving affordability for Canadians, helping small business provide access to medicines rather than through private coverage, but through public coverage. And as well as getting funding to provinces that desperately need more money for the healthcare programs. So we stand ready as a citizens-based organization to work with all parties to get Pharmacare done, as you say, Andrews. Thank you so much.
Thank you, Steve. And with that, over to you, Indira Naidu-Harris.
Thank you, Andrew, for that lovely introduction. And good afternoon, everyone. I can't tell you how pleased I am to be here with you all today to talk about a very important topic for Canadians and for our health, Pharmacare. You know, a national Pharmacare program for Canadians has the potential to be a game changer when it comes to our health and our healthcare system. That's because free access to medicine in Canada not only has the potential to improve our health, but it also has been shown to reduce inequities in the healthcare system, improve access to prescription medications, and reduce overall total health spending. The benefits are substantial. So substantial, in fact, as you just heard from Stephen Staples, that the federal Liberals made a national Pharmacare program a campaign promise in 2019. And the federal NDP attempted to push the idea forward as part of a private member's bill earlier this year. So, why does Canada still not have a national Pharmacare program? What's holding things up? After all, Canadians are the only country with universal health care that doesn't have a national free access to medication program. Well, our panel is here with us today to help us get to the answers to some of those questions and more. So let's get to it. Dr. Brendan Hanley, I'd like to start with you. Dr. Hanley, over 50 years ago, Canada took a major step forward in healthcare and implemented a publicly funded healthcare system, Medicare. This program is so important to Canadians that it's now become, frankly, a defining symbol of what it means to be Canadian. Now, here we are decades later, looking at another groundbreaking idea, free access to medication or Pharmacare. Tell me, what are the basic principles behind a national Pharmacare program for Canadians? What exactly are we talking about?
You know, you start off, Indira, with a really good foundation, and that is Medicare. And through that journey with Medicare and increasing experience, we ended up with the Canada Health Act. And the Canada Health Act, I think, really spells out the principles, not just for the core health care services within that, but also provide us the pathway for Pharmacare, and that the principles of that being it's universal, so everyone has access to the drugs that they need. It's comprehensive. It's accessible, it's portable, and it's public. So I think it's all there. And really, the idea of Pharmacare is really to wrap this additional package into the basket of core health services that we would offer as part of the as part of what's understood to be in Canada Health Act. So I think you know, as was mentioned on with Dr. Hoskin's report and then the report of the Prescription for Canada, the homework has been done. It really now is to how do we look at the implementation and how do we juggle the various big initiatives on our plate at the moment to see this implementation go through.
Well, thank you. Don Davies, I'm going to go to you next. Tell me, you know, the NDP has been talking about this for a while also, along with the Liberals. So why is it important for Canadians to have a national Pharmacare program? What are the benefits to you know, individuals across the country? Sorry,
well, first I want to thank the Pearson Centre for hosting this important discussion. Sorry, can you hear me now?
Yes, we can.
Can you hear me now?
Yes.
Sorry, my screen's freezing. I'm not sure if it's me or you, but I'll start talking and see what happens. You know, I think, Indira, it's rare that we find a public health policy that rings so many bells on clinical, on ethical, on economic grounds. Pharmacare really does it all. You know, as Brendan just sort of touched on, to me, I view Pharmacare as simply expanding the basket of publicly insured medical services in this country. It's really no different than anything else. You know, you break your arm, you go to the hospital, you go in, you get serviced, and you leave, and the bill is paid for through our public system according to the principles of the Canada Health Act. If instead you just collapse and were taken to the hospital and the treatment was instead a prescription medicine, there's no reason that should be treated any differently. You know, I think that's why every single Royal Commission, committee, advisory council dating back to the 1940s has recommended that prescription medicine be considered part of the basket of covered services. What are the benefits? You know, study after study after study shows that not only can we cover every single Canadian for the medicine that their doctors and health professionals prescribe, but we can save money as a country by doing that. The lowest estimate that I see that's credible is about $4 billion a year, and I've seen them as high as $11 billion a year. And that's through things like bulk buying, streamlined administration. I have to pause and just say, Dr. Eric Hoskins found that there are over 100,000 separate health benefit plans in this country. Imagine if instead you just processed claims through a single public healthcare system in each province and territory. And finally, cost-related non-adherence, which is simply a fancy term for if you treat people sooner when they're sick, you end up saving money by them not getting sicker down the road. So I think the benefits are just, they're undebatable, and they are comprehensive in terms of people's health, in terms of saving our system money, and in terms of, I think, living up to the principles of what Canadians expect in our healthcare system, which is a publicly accessible system where everybody gets access, regardless of their station in life or the size of their wallet, as a matter of right. Because right now, let's face it, we have two-tiered access to healthcare in this country. If you're rich, you can pay for your medication if you're covered, and if you're not, you don't. And I think that's fundamentally anathema to Canadians' values and what we want in our public healthcare system.
Thank you, Don Davies. Linda Silas, I want to bring you into this conversation. You're with the Canadian Federation of Nurses Unions, and so you really have a good sense of what's happening on the ground, I'd say. So I want to ask you the same question. You know, what kind of an impact do you think a national pharmacare plan will have on the health of Canadians, and what kind of an impact will it have on the everyday functioning of our system and what goes on in hospitals?
Well, my friend Dr. Hanley would know nurses are no nonsense people. And for us, for the last 20 plus years, we've been lobbying for a national pharmacare program because it is a nonsense that after you receive medical advice, medical consultation, and you get a prescription, it ends there unless you're hospitalized. And we see the revolving doors of the hospital all the time, where patients, young families, not elders, most of the elders are covered depending on where they live, but they all come back. They're not able to follow their prescription. They're not able to follow their medical advice. We've improved in our country the prescriber. We now have more physician, but nurse practitioners, even some jurisdiction nurses can prescribe, but it still doesn't guarantee you to get the medication, just gives you a piece of paper. And so it's again that nonsense that happens. I'm in Halifax right now and hearing nurses who work at the IWK asking me questions. How come we have to tell young families of asthmatic children that there's no program for them to get their puffers, and the children stay in the hospital because the teen can't let them go. They can't go to school. So those are just common sense. And we talk about, the big cancers, the big disease, but most medications are preventive. And Dr. Henley would talk about it better than me. But, if you don't take your cholesterol pill, you might end up with a stroke or heart attack. And the cholesterol pill would be something that somebody would say, maybe I don't need to take it. I can't afford to take it, or I'll cut it. I'll take one a week instead of. And so it is just a nonsense. And we've been talking about it for so long. Like, I've been on so many panels, mostly with Dawn, to talk about this. It's what our country needs, and it's time we do it.
Thank you, Linda Silas. Dr. Hanley, Linda Silas brought up so many good points. So reduces hospitalization. It actually improves the ability and the commitment that patients make to taking their medications and taking them regularly. So there's that whole preventative piece. And yet, as Linda mentioned, this conversation about Pharmacare has been going on for years. Why is that? What are the challenges when it comes to implementing a program like this? After all, federal Liberals recently pledged to move things forward. So what's happening with that, and where are things at in that deal that was made with the NDP?
Yeah, well, I can certainly give you my own perspective from sitting in the back row and participating in the House and some of the discussions, of course, but I was reflecting on some of Linda's comments, and it brought me back to some of those very visual memories of being in a hospital and seeing people arrive who had run out of their prescription. They weren't able to afford to renew it. Sometimes it was just finding something temporarily from the hospital to get them by. Or of course the consequences of those missed prevention medications that result in either illness, sometimes catastrophes. Because of an inability to continue. So these are really important principles. I think it's very, for one thing, I think the commitment is still very much there. And I think even looking at the budget, which I carry around with me everywhere, it's clearly outlined that the commitment for a national Pharmacare program is there. Certainly if we look back to the Dr. Hoskins report, the timelines, we're not keeping up with those timelines, and I think there's probably one big reason that has happened, and that's just a diversion of attention and funds because of managing the pandemic, and I think that has probably really kind of derailed the rather ambitious timelines that were in place. So I think, but I think it is important to state that commitment is there, and I think having the agreement with the NDP, I think we share philosophies and views in this regard. I think very closely, and I think it will help us to get there through the years ahead of us. I hope sooner rather than later that the commitment is to have a Canada Pharmacare bill. Working to have it passed by the end of 2023. So as I said before, I think much of the homework has been done. It is money, and there, even though we know and we feel pretty confident from estimates over and over again that this is going to save us money, we have to have upfront spending in order to get there. And so that's, now we're looking at a national dental program, which is also fantastic. We still have COVID, recovery and spending. We've spent on so many amazing programs, the child care being one of the most recent examples of ambitious spending that is going to have long-term gains but requires upfront investment. So there's a lot to juggle with it, with really quite a limited budget and in times where we are constrained. So I do think that's a real barrier, but And then I think the next aspect is working with the provinces and territories. And, you know, we know that there are very clear requests for more money in terms of the transfers. We also have a commitment on mental health, increased mental health spending through bilateral arrangements. And we know, as we were talking before we went live, about our shared work on the healthcare workforce crisis. And Linda's been such a great advocate for what we need in the nursing profession. Dawn and I work together on the health committee right now on a study about the healthcare crisis. So many competing priorities within healthcare, but definitely Pharmacare is still there as a key commitment.
Thank you, Dr. Hanley, and a lot to think about. You really touched on a number of things. Before I go to Don Davies, I'm just going to stay with you for one more question, because you touched on something there, talking about provincial governments and, you know, their role in much of this, and what that role is. You know, up in the past, it seemed that there was not much interest really when it came to free access to medication plans. I mean, we know that Ontario was a little different, but the Ontario NDP recently, you know, just very recently announced a plan to provide prescription drug coverage for all Ontarians as part of their election platform. So tell me, you know, in your opinion, what could this mean for the national conversation? And is this, you know, how does this reflect and impact sort of provincial engagement, if you will? Just wanting your thoughts on that.
You know, I think it's hard for me to know, you know, what they see as the chief hurdles. I suspect one of them is really just the sheer, you know, in already stretched environments and coping with these multiple challenges that the provinces and territories are definitely facing right now. It's like, how do we get there? Because we know that every time we have a new program, it's a big deal in terms of local legislation, implementation, even to think of collapsing multiple programs into one. It's so great to think of being there with ease of administration and a single payer program, but there's a lot of work to get there. So I think what I imagine is they're going to be saying is we need support to get there. We need time, we need money. To help us to get there, even though I can't see how anyone would not want ultimately to achieve what will be a more cost-effective and a simpler administrative system when we get to that goal.
Thank you. Thank you for those comments. Don Davies, I have to go to you. I want to find out if you have anything to add about the Liberal NDP collaboration on Pharmacare right now, and what are your thoughts, if any, on this collaboration?
Yeah, I think it's a very exciting time for healthcare in this country. You know, I think it's worth remembering that the last time that Canada had 2 consecutive Liberal minority governments federally, with NDP holding the balance of power, we got Medicare, we got old age security, we got the Canada Pension Plan. That was in 1965. And here we are, you know, in the 21st century, where we have the 2nd consecutive Liberal minority government with NDP holding the balance of power. And I think that both parties have recognized that in this parliament, and we see a historic opportunity. You know, I do have to say, in order sort of like it's important to be optimistic and positive, but I think we have to be also honest and realistic. You know, the federal Liberals promised universal pharmacare, almost exactly what we're talking about today, in 1993. That was in the Little Red Book. They had 3 successive majority governments after that and never brought it in. I have to also correct Indira a little bit on our act. The NDP drafted a Canada Pharmacare Act after the 2019 election. We drafted that bill as a standalone piece of legislation, exactly as Dr. Eric Hoskins prescribed, and the Liberals voted against it. So why are we at this historic point today? I think it's because we are in a minority position. I think to be honest, there's an ideological, you asked earlier about what the barriers are. I think part of it is financial, but part of it's ideological. I think there's a very strong consensus politically in this country on the center left, who believe in the public healthcare system, who believe in investing in healthcare. And who believe in public delivery. I think I'm going to talk about that because I think it's a critical part of this discussion. On the center right part of the spectrum, that's where you find disillusionment with the public system, and they prefer more of a private delivery model. I think that was expressed very much by former Liberal Finance Minister Bill Morneau, who gave a famous speech a couple of years ago, where the system he preferred was to keep the current system where people are privately covered through their employment, and we just have a public program for those that don't have coverage. That's a very different vision of Pharmacare, a different model than the one that we're talking about today, which is delivering Pharmacare through our public system for everybody. And by the way, I'll tell you that every single group, task force, commission, committee that has ever looked at this has consistently recommended in favor of public delivery, not for ideological reasons, but because it's the most efficient, economically prudent, and fair way to deliver it. We know that just by comparing us to our neighbors to the south, where the United States does not have a public Medicare system. They have tens of millions of Americans that don't have coverage, and yet they spend more per capita on healthcare than we do in Canada. So we know that it's through the delivery of prescription medication through our public single payer system that we realize the savings, because that's where we get the bulk buying power to buy medication on behalf of 36 million Canadians, where we have the streamlined administration and the cost-related non-adherence. And by the way, we also need better prescribing practices in this country and a more disciplined formulary that is taken away from industry. It's taken away from politicians. It should be set by objective, independent experts who are evaluating medication on efficacy, a value for money basis. So I started off really being passionate about Pharmacare. I now think we need comprehensive pharmaceutical policy reform in this country. There's a lot of pieces to improving the way that we deliver medication, and that's going to get even more challenging in the years ahead, because biologics and more expensive medications for rare disorders, where you're looking at patients that sometimes need hundreds of thousands of dollars of medication a year. So if we don't organize in a better way the way that we prescribe and deliver medication in this country, we're facing a very, very big mountain in front of us. And that's why I'm drawn to Pharmacare, because of the ethical and compassionate part of it. I just fundamentally believe everybody should get. How do you have a Medicare system without covering medicine? But we do in this country. And as you pointed out, Indira, we're the only advanced country in the world that has public health care that doesn't have some form of covered prescription medication. But I'm increasingly convinced we have to do it for economic reasons. So what we're talking about here really is reorganizing the way that we deliver medication. And by folding it into our public system, we end up saving money. Yeah, there's an upfront cost to it, but as a whole country, in a matter of a couple of years, we'll be spending less money on prescription medication in this country than we do if we keep the current system. And we cover the 20% of Canadians that have no coverage today, which is 7.5 million Canadians are walking around the streets of Canada right now that do not have a single bit of prescription medicine coverage. And that's not counting the people that do have some coverage, but they skip a pill, or they're unable, they have high co-pays or annual limits, etc.
Dr. Hanley, I'm going to bring you back into this because, Don Davies brought up several points. Having said that, the federal Liberals have committed to Pharmacare for a number of years. So you touched on the fact that we've had to deal with a COVID-19 pandemic. And so I have to ask you, is this a question of timing right now? Have there been challenges and realities that are making, is it still affordable? Is this something that we can do in the near future when it comes to Pharmacare?
Yeah, in my opinion, it is. I think it's what do we concentrate on right now, when there are some urgent urgent expenses, including, as I said, the pandemic spending, but of course we now have a war, so that there are just tremendous pressures at the moment. So an example where I was able to have a conversation with Minister Freeland about the mental health transfer. I did not see the mental health transfer in the budget, and I think it goes back to that NDP Liberal agreement that we actually do have time. We've got a lot to do. The commitments haven't gone away, including the mental health transfer, but it may not be reflected in this year's allocated spending. But that doesn't stop us from continuing down the pathway. So again, the commitment is there to have a plan by the end of 2023. So to me, that means looking at the original report, again, Dr. Hoskins' report, that a prescription for Canada, looking at those elements, starting those discussions with the provinces and territories that will be about health transfers, that will be about mental health gaps in healthcare, and in my mind, also about Pharmacare and how we move up the scale, and who's going to be first, and how do we look towards implementation. So I think, again, I don't speak for the Minister of Health in terms of the actual timelines, but that's sort of what I'm seeing or feeling from being being a member of the party and seeing how it's reflected in the budget.
Thank you for those comments. Linda Silas, I'm going to go to you, and I'm going to turn the question around a little bit. So I'm going to ask you this. Can we afford not to do this as a country? In your opinion, how will the introduction of National Pharmacare impact the work of our healthcare providers on the ground?
We can't not afford not to do it. Every region of this country is looking at how are we going to sustain our healthcare system now? How are we going to increase the health workforce? How are we going to provide home care? Dr. Hanley talked about mental health, long-term care. We haven't talked about that. And we know we're wasting, or we could say we're not wasting money with the programs we have now, because they're still serving about 80% of the population, but they're serving them in the most expensive way. So that's a waste when that money could be spent somewhere else. And all the research and all the auditors, from the parliamentary officers to every committee to every researchers, we've hired economists up the yin yang to study this. And it is between $4 is the minimum billion to $11 billion savings. And one of your questions to the two politicians here was, are the provinces ready? Maybe I've been around way too long. Sometimes I think it's the age of the dinosaurs. But I was there in 1997 when the Liberal Party had national roundtables around Pharmacare, around home care. We still haven't done that. I was there at the Council of Federation in 2004 when Premier Williams from Newfoundland Labrador came outside and said, "What are you nurses talking about a national pharmacare program?" We had a tiny research paper. He went in and the premiers talked about it, and they asked the federal government to start talking about a national pharmacare program. That was 2004. And you might remember Paul Martin had a plan for the next generation that September. And the plan of the next generation had a national, it was called a pharmaceutical strategy. And then we spent 10 years studying it, research after research, and all saying the same thing. We need it. We are a small country. We're 37 some million. And as Don was mentioning earlier, we have over 100,000 private plans. It's crazy. And imagine the prescriber and the patient. Okay, what kind of plan do you have? Does it cover this? Does it cover this? And then the mismatch, so it doesn't work. And when politicians tell me, well, I'm not sure if it's the right time, Linda, I say, okay, let's go back to 6 months. You implemented a national child care program. just like that. And the last province to sign on was Ontario. Now every province and territories will have access to childcare under $10 within, the next few years. That's action, and that's what we need for pharmaceutical in this country, is working together, and we will get the premiers back on it. The problem is we've had many, many elections. The last time, my last point on this, we've all mentioned the study around Dr. Eric Oskin reported in 2018-19. The Council of Federation in 2017, 2018, all came out saying to the federal government, we need a national program. That's why it was part of many political agenda for federal elections. That's why Hoskin was hired to do it, because the premiers were saying, now we've changed all of that, so we have to work with them again, which we will, but it's this democratic wheel that we're in, that when we make progress and then they all change and we have to start over. But we have to be as quick as we were with childcare. It was a mandate. It wasn't even talked about in any platform from the Liberals. It was, we should look at it, but it was decisive. It was, here's the money, here's the principle, and are you going to sign on the dotted line? And they did.
Thank you for those comments, Linda, and I'm certainly aware of just how challenging the childcare issue is and can be, and so your comments are very important. But I'm going to pick up on something you said there. You talked about seniors, and you talked about the impact of a national Pharmacare plan on certain groups in our communities and people in need. So tell me, how would a plan like this affect seniors and long-term care homes and so on? But also, what about cancer patients? Because some of that medication can be very expensive and restrictive in terms of what people are able to access. What kind of an impact would a plan like this have on those folks?
So for patients, it would simplify it. That's the simple thing, simple answer. For the prescriber, for the physicians, the nurse practitioners of the world, they would have an essential list. So that essential list is based by experts. So it wouldn't be the Linda Silas or the Don Davies lobbying and drug X needs to be on the list. We have to get away from that. It has to be a group of experts. And the federal government has started. There is a committee established. There's an agency, Canada Drug Agency, that started. So they're starting there. So we would have the list approved by experts. We would have the bulk buying, as we say, it's the Costco model. The more you buy in bulk, the cheaper it is. But it will also be based on the best practice in prescribing. So a doctor like Dr. Hanley, way up in the Yukon, might be able to go right to the source of this agency and say, this is the best way to prescribe this medication. And again, simplifying it, make it more safer, and in the long run, more efficient and cheaper for society as a whole.
Dr. Hanley, I'm going to go to you, and I'm going to pick up on some of the things that Linda Silas was saying. She was talking about the need for a bulk purchasing and, an essential drugs kind of list. Talking about that, some of what I'm aware of that's happened in the past is every now and then you're dealing with new medications being developed, and sometimes some of those medications are very costly and have very high prices, in some ways almost sort of designer kinds of medications where they're there to be used by a group of folks that really need them badly, but the costs are unbelievable. How can we come up with a national Pharmacare program that is able to act quickly, to add, because there's a system in terms of what's a new development that is actually going to be able to go through the kinds of processes we need to put them through so that they have the testing that's needed and so on, and can be provided to folks right away. And then also, in some instances, these prohibitive costs that some pharmaceutical companies are charging for some of these medications. What can we do? How do we get around some of these challenges?
Yeah, these are excellent questions, and again, I think we can look no further than the Pharmacare report in 2019. The simple answer to a very difficult question is pooling. But pooling resources, pooling money is the way to help us navigate that dilemma of having often extraordinarily expensive medications. I know in the report they talk about some drugs being up to 2 million per person for new drugs for rare diseases. Now clearly that on mass scale that wouldn't be sustainable, but there are all kinds of gradations of either the numbers needed that would need those drugs, or costs that are in some cases not out of this world, but still way too difficult for any normal drug plan to afford. So by having a national program that is as part of Pharmacare that focuses on drugs for rare diseases and super new expensive drugs, we can have pooling and be able to afford that out of a large public pool of money. It's definitely one of the advantages. The other thing, of course, and both Linda and Dawn have mentioned this, I think, is the real need for having a national formulary, but also a consistent way to evaluate. Drug X comes out, it's great. Is it the right thing? And are there alternatives, or is it really revolutionary and therefore worth the cost? And that brings in bioethics. It brings in careful scientific evaluation, peer review, looking at international examples. There are well vetted processes for how we get there. But I think that is another big advantage of having Pharmacare. The national formulary, as Linda explained, I think is a critical part of this. A drug agency as an independent body that oversees the acquisition, the bulk buying, the regulation, the maintaining the formulary, and also to reiterate the importance of wise prescribing, so that we as providers, as healthcare providers, we need reliable, non-biased sources of information to guide prescribing. And there are many initiatives around the country that, as a practitioner, I've been aware of. Some wonderful. There's the Choosing Wisely program in Canada. There are many provincial level bodies that have excellent ways, but again, it's bringing all that wisdom into one place, so that and Sweden is a good example of a country that has done that to achieve rigorous and consistent and evidence-based prescribing practices that we would be able to afford by having that public pool.
Oh, thank you, Dr. Hanley. Such important points, and really, illuminating for us some of the real challenges that folks will have to figure out as we move forward with this. I'm going to just move very quickly to each of you. I'm wrapping up right now, but very quickly asking each of you your final thoughts. Don Davies, very quickly, thoughts on this as we leave this conversation right now?
Well, again, I think we stand at a very exciting historic moment in history, Indira, that we do have a consensus. I give Prime Minister Trudeau and Jagmeet Singh full credit, and both caucuses. I can tell you I've spoken with many colleagues who are very excited. I think we stand at a time when we can see the single largest expansion of public health care in half a century. We built the system in the 60s, and we're talking about Pharmacare and dental care. And I think what's important to remember is that these are not luxuries. This is part of primary health care. Canadians are very proud of our public health care system, and it is excellent in terms of hospital care and physician care, but it's not comprehensive. We don't cover our ears, we don't cover our eyes, we don't cover our mental health, we don't cover our prescriptions, we don't cover our teeth. And so I don't view prescription medication or dental care, for that matter, as luxuries. I view them as essential components of primary healthcare. You know, Linda
Right.
and the CFNU did groundbreaking studies that showed that not having access to prescription medication kills. They did a study that showed just from a couple of different conditions, diabetes and cardiac issues, that we lose hundreds and hundreds of people. I think it's fair to say thousands of people die every year simply by not getting access to medication that if they did get, they would be alive. So I'm
Thank
really looking forward to working with my colleagues, and I'm hopeful, and I think a generation from now, Canadians will look back and maybe they'll look at Prime Minister Trudeau as the father of Pharmacare, like we did with Tommy Douglas, and I think that'd be a really good thing.
Thank you, and thank you for those comments. Linda Silas, just very quickly, you know, your thoughts about the future. I don't want to take away from our audience's chances to have some questions for you, but very quickly, thoughts about the future?
Indira, you said it. It's going to be a game changer. And right now, key is to get it done. It cannot become another political election for whenever we're going to have another federal election. It has to be done now, has to be done under our current government, under this agreement, and let's get on with it.
Thank you. Dr. Hanley, final thoughts.
Thank you. You know, Linda talked about the child care plan again, and I think it's such a good analogy. Quality, affordable, and those are, you know, quality prescribing, quality access for all, comprehensive to affordable medications. It's right before us, and I think we can do this, and I certainly share Don's enthusiasm for the agreement and his optimism, because I do think we can get this done.
Fantastic. Okay, well, thank you so much for your thoughtful answers and comments, everyone. Andrew Cardozo is going to join us now with some questions from the audience. And so over to you, Andrew. Uh-oh, Andrew, you're going to have to open your mic. Unfortunately, we can't hear you, Andrew.
Can you hear me now?
Yes, we can. Now we
Okay,
can.
all right. We've had a few questions. They're quite long. I'm going to summarize them, and hopefully I'll do a good job so that we have more time for you. The first question was, with federal, provincial, territorial negotiations, how do we make sure that this doesn't get waylaid and that it actually happens? And I'll ask you to start, Don Davies.
Well, that's an excellent question. Thanks for that. I mean, I think there's really two issues we have to really identify. One is that there's an unprecedented consensus among all premiers and territorial leaders right now that they want to get a stable long-term funding to the Canada Health Transfer. I think it's fair to say our primary healthcare system is, if not in crisis, under a lot of strain. And so they are coming to the table wanting that money. And so I think we have to address that, because if we're talking about expanding services to pharmacare or dental care, I can understand why premiers are reluctant to take on new services when they feel that they don't have their current primary healthcare systems properly funded. So I think we have to do that. And second, I think the federal government is going to have to come to the table with substantial and dedicated funding. I personally would like to see a separate standalone pharmacare transfer. And we set it up just like we do our current system, where we say, here's the national formulary, which we will be developing over the next 36 months. And we say to the provinces, any province who agrees to follow the principles of the Canada Pharmacare Act that we will be drafting and covers their citizens in their province according to those principles and according to that formulary will receive federal funding. That's exactly how Medicare works today. And that respects provincial jurisdiction. Those provinces that want it will do it. Those that don't, won't. I personally think at the end of the day, all provinces and territories will take federal funding, but it's going to take both of those things, fixing our primary healthcare system and a new dedicated source of funding for pharmacare to make this work, I think.
Yeah. Brendan Handley, can I get your thoughts, having been a senior official with a territorial government? What do you see as the stumbling blocks?
Yeah, I think Don really nailed a few key aspects of that. recognizing the multiple challenges. You know, we do, and I know as a Yukoner how we're facing the crisis in the toxic drug crisis right now, and the toll of opioids, as well as mental health pressures. Shortages of nurses, you know, around the country, but also at home in Yukon, shortage of providers, the burnout, the pandemic pressures. So it really is recognition of those multiple pressures, and how do we take on a new program? We've shown we can do it. I think that the funding is absolutely essential, and that is also a federal lever, as well as an incentive. And consistent federal leadership that got us the childcare planning, I think, is going to help in the same way to help us navigate through the next couple of years of working out the federal health transfer and the kind of add-ons in mental health and Pharmacare.
Okay. Thank you, Linda Silas. You work with all the provinces and territories. Do you see reluctance there, or do you think this will happen smoothly?
First of all, we can't put the blame on them. They're all struggling with the healthcare budget, so there'll be a lot of discussion with the federal government on health transfer. So I agree with Don that it will have to be a separate silo, and then in the future negotiation, I'm sure it'll be brought together. But what they need, what we need from the federal government, is bringing the expertise together, bringing the standards, so the standards are all the same across the country, and the funding. And then the provinces and territories are going to sign on. But before they see that, they have other fish to fry, which is just trying to look at the backlog of surgeries, for example.
Don Davis, let me ask you a next question with regard to the costs. Will there be cost savings overall, or will we end up with more bureaucracy trying to administer this?
Well, you know, that's one of the nice things about Pharmacare, is that, as I think Indira, or maybe it was Brendan, said early on, this is really a shovel-ready program because it's been studied so comprehensively from so many perspectives and so many bodies for so long. We have a very, very good sense of the economics of it. And again, it's there's a consensus in this country, including from the parliamentary budget officer, who has costed out a Pharmacare program twice in the last 6 years, that we will, in the long run, as a country, save money. And, you know, I want to talk for a second just about the private sector businesses. We very often say to the United States and other countries that our public healthcare system is a competitive advantage to do business in Canada. And we try to attract business here for that. I know that the single fastest rising cost in an extended benefits plan for a business in this country is the pharmaceutical component. And so we've heard that from boards of trade across this country. So, and we also know that young people, millennials, when they go to work, they're not getting the same plans that we got when we were in our 20s and 30s. And so increasingly, Canadians are not getting the coverage through work, and employers are not able to afford it. So the beauty of single payer Pharmacare is that, again, by reorganizing the system and by these completely analyzed concepts of streamlined administration, bulk buying, and cost-related non-adherence, we end up saving money in the long run. So, but with an upfront investment, and I think it would cost, you know, I don't have the figures right at hand, but you know, in the order of billions of dollars up front, we end up saving our entire population in very short order. Like within 3 or 4 years, we start getting a return on this, and that's not to even count the benefits in terms of increased and improved health. So
Yeah.
Yes, the short answer is yeah, we save money, cover everybody, we save money. That's the bottom line of universal Pharmacare.
Yeah. Linda Silas, anything to add on that in terms of costs?
We have a plan, Andrew. You know, Dr. Hoskin and his team in 2019 presented, and it was a government funded commission, presented a plan, and what was it called? A Prescription for Canada Achieving Pharmacare for All. And in there was separate steps, because he wanted to make sure we looked at what employers were paying, what the different provinces and territories were paying. So there were different steps on not only implementing it, but how we were going to pay for it and how we were going to save money in the end. And his conclusion at the end was about a saving of $5 billion. So regardless if it's 5 billion or 2 billion, it is about covering every people living in Canada that needs a prescription plan. And that's the real saving. It's about lives, it's about quality of life, and it's about, in the end, saving our healthcare system, because you wouldn't end up into a hospital because you can't take your prescription drug.
Yeah, Dr. Handel, let me ask you the next question with regards to the next steps ahead. Can we go the route of the National Child Care Program, where the federal government signed a series of deals with each of the provinces and territories, and then we'll do the legislation in the fall, or do we need legislation first in this case?
I think it's likely to be a stepped approach, and I think the preparations underway will be looking at the legislation for, and at least from my understanding, it would be coming up with a Canada Pharmacare bill, but that doesn't have to, the conversations I would anticipate will be already occurring when we're, again, engaging with the provinces and territories on multiple healthcare fronts. You know, whether it's long-term care or the backlog of care, mental health, the healthcare transfers. So I think we need to be moving as we're developing the legislation on the national pharmacare bill, that we're having these conversations on what would implementation look like. I do think it would likely end up with these one-off bilateral agreements, at least to get established and to recognize that we are a federation and that some provinces and territories may be more ready than others to jump onto this.
Yeah, Linda Salas, your thoughts? You'd mentioned earlier about how we've done childcare. Would you like to see the agreements first or the legislation first?
My message will go to the two politicians sitting with me virtually, is make sure that in your caucuses that you discuss the Pharmacare Act, the standards attached with the money. Please, let's not have more pretty words on a piece of paper in Ottawa without a commitment of funding that will link the province and territories. And that's key. That's what Canadians are waiting for from both your parties, is standards attached with money.
Okay, Don Davies, I'll give you the last word, and I wonder if you, in part to respond to Linda's request, but I also would like to ask you to comment on how you see the steps happening between your party and the Liberals in the months ahead.
Well, those are two excellent questions. Well, you know, we do have the precedent of the Canada Pharmacare Act already drafted. I think that provides at least a reference point for the government to look at and make modifications as they see fit. I think the next step is for the NDP and the Liberals to sit down, roll up our sleeves and take a look at that legislation and find out where there's agreement and where there may be differences so that we can work on those. I personally think there needs to be legislation first, because I think before we sit down with the provinces, we have to be able to tell them what it is we're asking them to sign onto. So I think having the basic outline of it done will be helpful. You know, I just wanted to go back quickly for those that like math that may be watching. You know, Dr. Hoskins estimated it would cost about $3.5 billion in 2022 to launch National Pharmacare. That's for essential medicines, and that would grow to about $15 billion in 2027. Now, that's a significant line item in the federal budget, but offsetting that would be businesses would see their prescription costs reduced by $16 billion, and your average family would see their out-of-pocket drug costs reduced by $6 billion. So you see how by reorganizing the system, we end up saving about $7 billion, but there's that upfront cost. Again, I think, as we used to say in the Teamsters, talk is cheap, but money buys whiskey. You know, at the end of the day, we need, you know, we need to fund our public healthcare system. So we have a political choice to make, and that is, you can have as good a healthcare system as you're prepared to pay for. This is not going to be free. There's no such thing as free healthcare. To cover Canadians for prescription medication will cost money. But again, I think by the federal government playing a leadership role, drafting the framework, and again, let's just use the Canada Health Act. Canadians understand it. We're all familiar with it. We like it. We know it. Prescription medicine, we're not talking about kryptonite. We're talking about just a different form of medical therapy. Let's just add it to the basket, as I've said before, and figure out how to finance it. And once we have that figured out, you go to the provinces, I don't think there'll be a single provincial premier or territorial leader who will turn down, you know, real federal funds that are geared towards having every citizen in their jurisdiction have the medicine they need when their doctors or nurses or practitioners prescribe it. So it's hard work, but as Tom Mulcair, our former leader, used to say, everything left is hard because all the easy stuff has been done. I think so. That's what we got to get to work on.
Yeah. Okay. Yeah. A lot to get done. A lot and high expectations. Before we close off, and I'm going to turn to Indira Naidoo-Harris for a final word from her, but I just want to remind our audiences about a couple of other things happening. Today's session is part of our Pearson 125 commemoration. We're looking at this is the 125th birthday of Lester B. Pearson this year. Actually, the birthday was a couple of days ago. We're having a series of panels that look at his legacy and where we go. So talking about Pharmacare is really, I think, as Dr. Brendan Handley mentioned earlier, the next chapter to Medicare, which was brought in some 50 years ago. Tomorrow we have a session called Democracy in Danger. And on Thursday, we have a session with the Minister of Labor. We'll be talking about the issues that he's dealing with. I want to thank Dr. Brendan Handley, Linda Silas, and Don Davies. You each bring really important aspects to the discussion here, but more importantly, to making this happen, whether it's through your union or through Parliament. So we thank you enormously for the time you've given us today and helped us understand what needs to happen next. And for the final word, over to you, Indira Naidoo-Harris.
Thank you, Andrew. And all I wanted to say is just thank you to all of you. You know, this is such an important initiative for our country and for Canadians. And it is clear to me that every single one of you taking part in this conversation is committed and understands the value that this will bring to our healthcare system. And so I just want to thank you for all of your efforts and your work in this area. It's very much appreciated, and your thoughtful answers. Coming up on Thursday, if I may, Andrew, I've got two conversations coming up, one with Seamus O'Regan on basically the workforce and the challenges when it comes to labor. You know, we've just come out of COVID-19. We're still in the pandemic, but it's created a lot of challenges for regular Canadians, and it's going to be an important conversation about what we should be doing and where we're going next. And also, Linda, I know you'll like this one, but also on Thursday, Margaret McCain talking about childcare, which is a topic that I'm very familiar with and very committed to. And so I'm looking forward to that conversation about how we move that needle forward and really give Canadians and Canadian families the support they need as we come out of the pandemic and head towards a successful future for all of us. So looking forward to that.
And is it the Margaret McCain, a proud New Brunswicker?
Absolutely.
You see, we're moving on. We're going to change the world.
Best ones come out of New Brunswick.
Thank you.
And the